68-year-old Dr. Stephen Watiti has been living with HIV and AIDS for 35 years.
Let me tell you this. If you saw me in 1999, I was a very sick man. I had TB.
Dr. Watiti's success story is attributed to his commitment to taking his ARVs regularly as prescribed by the health workers.
I started talking openly about my patients. Some of them didn't also believe it. Some of them actually believed that I had been paid a lot of money by Americans to tell them like that, so they saw the medicine.
He was a keynote speaker today during an induction meeting of members of parliament on matters relating to HIV and AIDS in Uganda.
About 60 people die daily, 60, more than COVID. HIV is killing.
During the meeting held in Kampala, the Director General of the Uganda AIDS Commission, Dr. Musoba, revealed that 5,300 babies were born infected with HIV and AIDS in 2020.
That is a very unfortunate statistic.
These revelations raise concerns from the lawmakers on whether Uganda is progressing in the fight against HIV and AIDS.
We have put in place all the ways in which we can prevent babies from getting HIV and AIDS. When you go to Botswana, actually the transmission of mother to child, HIV/AIDS transmission is at 0%, meaning that even here in Uganda we can achieve and hit that target.
If possible, government should take charge of taking care of these babies.
The sex workers, who are the bridge population when it comes to HIV transmission. We all know that that category of key populations.
The Commission has also reported a reduction in new infections to 38,000 from 56,000 and the reduction of HIV and AIDS deaths to 22,000 from 56,000.
We still have a group of people out there who are HIV positive, who are not yet on ARVs. Some of them know their status, some do not know.
A survey reveals that Kalangala has the highest prevalence rate of HIV and AIDS, followed by Kabarole, Mbarara, Gulu, Masaka, Karungu, Kyotera, and Kampala, while Karamoja region and West Nile presents the lowest prevalent rates.
Although the average is 6.2, that is for women, it is as high as 7.2, while for men it's 4.7.
In order to intensify the fight against HIV and AIDS and bring infection to zero by 2030, Uganda AIDS Commission requires $8.2 billion, approximately 29 trillion Uganda shillings, in the next 10 years. Currently, funding for HIV and AIDS fight is largely dependent on donors.
Treating a patient of HIV/AIDS is damn expensive than protecting it. So I believe by having a protection measures, it will actually help us to control and to manage the finance.
According to the Uganda AIDS Commission, if the money is availed, 130,000 new infections and 51,000 deaths would be averted annually. The Commission wants government to operationalize the HIV and AIDS Trust Fund, which was established in 2014 after the enactment of the law. This requires government to set aside 2% of her annual budget, which currently stands at 45 trillion Uganda shillings, translating into 900 billion shillings into the trust fund annually.
It is not operational up to now. One key, purpose why this was set up was that it was supposed to provide part of the domestic alternative financing.
Currently, about 1.3 million Ugandans are living with HIV and AIDS, and about 1.2 million of them are on ARVs. Jingo Francis, NTV.